Welcome to 52 Questions. I'm Shannon Weber, Director of HIVE. Every year, HIVE answers hundreds of questions from patients, their partners, and providers, and each week in 2018, we're bringing one of those frequently asked questions to you in video format. And for this week's question, I'm at the International AIDS Conference in Amsterdam with a very special guest, Bergen Cooper. I'll let you introduce yourself in a minute. And because you're so smart and so amazing, we're gonna ask you a two-part question.
Ooh.
And the two-part question is, one, what is the Global Gag Rule? And two, how does the Global Gag Rule impact our HIV work?
Great, thank you so much. So I'm Bergen Cooper. I'm the Director of Policy Research at the Center for Health and Gender Equity Change in Washington, D.C. We're a women's rights organization that advocates for the sexual and reproductive health and rights of women and girls in U.S. foreign assistance. So the Global Gag Rule, to start, it has three names. Originally, the policy was called the Mexico City policy.
Okay.
Advocates have called it the Global Gag Rule since the beginning. Under the Trump administration, the policy was expanded and renamed, and it is now called Protecting Life and Global Health Assistance.
Okay, so it's only advocates that call it Global Gag Rule.
Pretty much, but
Okay.
generally you'll hear people calling it Global Gag Rule. A lot of the documentation you'll see on it, both in peer-reviewed journal and anecdotal evidence, will refer to it as the Global Gag Rule. So what is it? It's a policy that, when enacted, prohibits foreign organizations from providing, referring, doing advocacy to liberalize abortion laws if they take U.S. global health assistance. Now, it's like a light switch. Republican presidents, they turn it on. Democrats, they turn it off. It first started under President Reagan in 1984. When Trump became president, he expanded this policy. It used to only apply to family planning funding, which was about $500 or so million. He expanded it to all of global health assistance. So it is impacting nearly $8-9 billion. So about 15 times the amount it was impacting before. So how does this impact HIV?
Right.
Well, in past iterations of the policy, even though it didn't necessarily apply to HIV funding, it did impact HIV services, because if we think about clinics where people go to get family planning services, they'll also be there getting HIV services. So in the past, the policy is associated with closing down services. In the past year, we have already seen dramatic impact on HIV prevention, treatment, and care. This past January, I was in Mozambique. I met with an organization called Amodefa. They are an SRHR organization in Mozambique. When they had funding from the US government before the policy touched them, in one 3-month period, they were able to reach about 6,000 adolescent girls and young women for HIV testing and counseling. Now, once they lost funding, in another 3-month period after they lost funding, they were only able to reach about 600-700 girls. So we're losing thousands and thousands of patients. And that is just one clinic and one story and one type of service. We are seeing impact in all services, HIV, family planning, tuberculosis, because health is all one thing, and people are going to one clinic to get all of their health needs, and we're seeing the policy really curtail those services and close clinic and hurt people's lives. It's really ironic that the policy was expanded to be called Protecting Life and Global Health Assistance, when it is in fact associated with an increase in abortion. So this is a policy that is associated with, in fact, death.
Wow. Okay, so don't want me to spring a third question on you, but if you're pissed off now, like I am, I know you guys have a great report, which we can link to in the video. Is there something else that someone should do or could do, I guess, if they're upset?
If someone is upset, I think you should look into all of your options, and we talk a little bit about what some of those are in our report.
Okay, great.
Prescribing chaos. Please flip to the conclusion and look through the recommendations, and I hope for each of you, whether you're a researcher, a U.S. citizen, a funder, or a politician, you will find a recommendation for you.
Awesome. Thank you so much for joining us.
Thanks for having me.
All right. Have a great week.
All right, bye.